Hello and welcome to For Your Health. I'm Mark Crosby. Thank you so much for joining me and my guest. My guest is Katelyn Kirby. She is a public health nurse in the city of Quincy. Katelyn, welcome back.
Yes, thank you for having me, as always.
As always, it's a pleasure. Today's topic has to deal with lead poisoning and how folks can avoid contact with lead. Lead, especially lead paint, has been used or had been used in houses years ago. I know that there's a move now, and there has been for quite some time, to remove all of that.
Yes.
But even in the removal process itself is also concerning because it does, I suppose, lift all of that lead paint dust, which in turn can cause problems.
Brings it into the air to inhale.
And there are health risks when exposed to lead.
Yeah, so specifically for our children, in Massachusetts, we have a law to protect our children because, of course, they should be in a home that is safe from lead because there are many lifelong problems and health risks that can happen if you're exposed to lead. So I just thought it was a very important topic. It is Lead Prevention Week, and I recently have linked up with Kate Tenney in the Healthy Homes program here in Quincy, and just to really bring to light this issue and why it's important to address it and address it appropriately to protect yourself.
So this week that we are in is Lead Poisoning Prevention Week?
Yes.
And this is the week of October. We're recording this on October 21st, I guess. So the week of this entire week is Lead Poisoning Prevention Week. Yes. Let's go over the overview. We will start with what is lead poisoning. Why is this topic important to the community? And I know you spoke about the Quincy community, but certainly it's important in any community throughout the nation.
Yes.
Massachusetts lead law, health concerns linked to lead poisoning, how to determine if your child has lead poisoning, preventative measures, find out your level of risk, and resources for concerns or questions about lead. So, again, definition. What is lead? What is lead poisoning?
Yeah, so lead is a metal, and it is very toxic to the body, of course. So lead poisoning is caused by swallowing or breathing in lead, which can stay in the body for a long time and cause irreversible harm. According to the Massachusetts Department of Public Health, most of our lead exposures and lead poisoning in Massachusetts comes from lead paint and dust in older homes, specifically homes that are built before 1978, because that's when that lead was banned. So that I'd like to say the lead dust we're talking about, so it would make sense in older homes if you have paint that is chipping or old windows that are painted. When you're opening those windows, you're scraping in the paint and it's becoming dust that you can then inhale. And although everybody can be at risk for lead exposure, we specifically are very concerned about children under the age of 6, because if you think of them, they are in the developing stages, and so they, specifically for children who are toddlers and they're teething and learning to crawl, you want to think in that stage, which I currently am in right now with my daughter. She's crawling around on the floor, so they're more likely to get dust on their hands. And they also, at that age where they're learning the world and exploring, all objects, whether it's a food item or not, they go from their hands into their mouths. So of course, if your home has lead dust around, those children are really at risk because they would be putting that in their mouth all the time.
And you had said, right, putting something in their mouth, they simply, and folks might get a visual of this, based on their height, they might be up to a windowsill, and they could chew on the windowsill.
Yes.
And if that windowsill has lead paint, well, there you go.
Yes, my daughter, who's currently 16 months old, you kind of think, before I was a parent, if you think of a child biting on a windowsill, it sounds a little crazy.
Right.
But with a 16-month-old at home, you kind of realize it's not that far-fetched. Specifically, because I know she's always standing on my couch looking out the windows. I also have a mattress that's pretty close to a windowsill as well. So although, luckily, knock on wood, she's not gnawing at that by any means, I have seen her teeth on the windowsill.
See.
So it's not that far-fetched.
No, and again, I think it has to do with the height. It's
Yes.
her mouth is at that height. Not only her mouth, but children at that age.
Yes, and they're exploring the world, and that's a part of the way that they are learning. Because, of course, as you get older, you learn, do not bite on that windowsill, and it's easier to communicate.
So let's talk about the Quincy community specifically here. But then again, any community throughout the country,
Yes.
a concerned citizen, resident, should look at their state, at their local health department, to their state health department
Yes.
as well.
Yes, and as a public health nurse here in Quincy, I did want to mention why, like the Quincy community, but it also goes along for like the East Coast. It's all of, because our communities were built so long ago.
True.
So I had mentioned the United States banned lead-based paint federally in 1978. So this ban means that houses built after 1978 do not have lead-based paints. But 24% of homes built between the 1960s to 1978 have lead paint. 69% of houses built between 1940 and 1959. And then 87% of houses built before 1940 still have that paint in there unless it has been addressed. And again, in Quincy, this community we have a lot of history here. A lot of our homes are very old. So at this point, we have a lot of homes in our community that were built before 1940 and even larger amount of homes before 1978. And at this point, the paint that may still be in those homes is 50 years old and it may be deteriorating. So you might see it peeling or chipping. I heard the term like alligator skin, like you kind of like it. If you think of the skin of an alligator, it's really rough and
Right.
So that's one way. If you saw like a windowsill that kind of depicted like an alligator, that is, you might want to call the health department to get the ball rolling of where you should start to determine your risk. So that I wanted to say that for the Quincy community because a lot of our homes are older, but again, any homes on the East Coast, and this can expand all out west.
Of course.
So doesn't matter where you are. If you have concerns, you can check in with your pediatric office for your children, or local board of health or state health department.
And there is a Massachusetts lead law.
Yeah, so in Massachusetts, this lead law, this protects a child's right to lead-safe homes. It requires the removal or control of lead paint in houses with children under 6. So if the house was built before 1978 or it's being sold or rented, sellers, real estate agents, and owners who rent their home are required to notify the buyer or tenants of that lead risk. So I know myself, I'm very fortunate to have been able to purchase a home in the past couple years, and that was a big thing, that lead document, to ensure that that was signed and submitted to know our level of risk. And I'll go, as we get further, I'll show the viewers how they can determine their home. Like if they're either owning or renting and they don't know, I'll show them ways that they can find the year of their home and also whether it has been de-leaded or not.
Very good, very helpful. Let's look at the health concerns linked to lead poisoning.
Yeah, so initially lead poisoning can be hard to detect because people can seem to act healthy and be healthy even with high levels of lead. But it's important to know that any level of lead within a child's body can lead to long-term health effects, which can include damage to the brain, kidneys, and nervous system. It can slow down growth and development, create difficulty learning, damage to hearing and speech, and behavioral problems. So although that can be very concerning, and a lot of times your child might be acting okay at home, and you might not even realize any of these things until they become school age and they enroll in school programs, and then they're not keeping up with other children. So that's why it can be silent. So that's why it's important in Massachusetts, and under that law, we require testing for children under the age of 3 to really determine that risk, because again, it can be silent. They might be acting completely fine, so you might not know that they have that exposure.
So let's get into that. Let's look at how that's determined if your child has indeed been poisoned by lead.
Yeah, so again, the only way to determine is a lead test, because again, they may not appear sick at all. So in Massachusetts, and this is, we had talked prior to the recording, this is probably universal because it is federally no longer allowed in homes. So if you are not in Massachusetts and you're watching this, I recommend looking up online for your state health department, their laws. But specifically here in Massachusetts, a child that has to be tested at least 3 times. So it'd be once between 9 months to 12 months, at age 2, and again at age 3. And these tests are typically done at routine pediatric visits. And what happens, so with those lead results, they have to be reported to the state health department. Because if it's a blood level of concern, which would be between 5 but under 10, or lead poisoning levels, which is at 10 or higher, it triggers the state involvement. So the state's notified. Working for the local Board of Health here in Quincy, often if there is a lead level of concern, either the pediatric office will reach out to us specifically, or the parent or guardian of that child is recommended to call us. And at the local Board of Health level, our housing inspectors, if there is a child under the age of 6 and you're renting that property, they will come out to do a lead determination test. It is not as comprehensive as a whole lead inspection. So although my department may be able to come out to do that lead determination, depending on those results, they'll refer you to the lead inspector, who has to be certified by the state. And it does get a little bit costly, but it is mandated. So that's how we get involved, and then we follow up with that, and we have to make sure that that lead inspector was hired and they went in, and that issue is no longer an issue in that home.
Well, and if it's a homeowner and it's been determined there is lead in the home, I think at least in the city of Quincy, there are monies to kind of offset the cost.
Yes. So for if you are the owner and you have a child younger than 6, you can still, I always recommend call the health department just to see where you should start. But the owner, I was informed, has to pay for that lead inspection. So it's, whereas when we're going out for renters, if that comes back positive, we would then make the landlord pay to have it remedied.
Okay.
But again, with that payment as the owner, there are programs out there. For example, here in Quincy, we have the Healthy Homes program through our planning department. And they are able, I'll go into it, but they're able to give certain loans depending on your eligibility that will help the owner fix the issue.
And they are forgivable loans.
They are forgivable loans, yes.
We'll get into that in just a bit. Let's talk about preventative measures. Obviously, get the lead out of the house. Possibly don't even purchase or live in a place where lead could be.
Yeah, so which can be hard, especially in these communities where our housing may be older. But so the number one preventative measure, again, is removing it, as you just said. So lead encapsulation and abatement are the best options as they reduce the risk of exposure long term.
And as you mentioned that, just for folks, don't remove it on your own. There are companies that are equipped to deal with lead. If you're removing it on your own, number one, you're ingesting it,
Yes.
likely, and you may not be getting it all.
Yeah, so it actually has to be done by a professional because they do it a proper way. They have measures in place to, again, limit the dust exposure. So as you just mentioned, don't start scraping that away yourself. Call the health department, see where to get started, see if there are resources out there to help pay for it. Because it is a very serious issue. And again, you don't want to be scraping away at something that you don't know if there's lead or not.
Right.
Yeah.
And again, it's a fine dust that you can't, it's difficult to see.
Yes, and as people probably can realize as we live in our homes, dust accumulates very quickly and silently. So you want to make sure you're cleaning all those areas. But just before I move past this encapsulation and abatement, I just kind of want to describe what those mean. So the lead encapsulation is a lead abatement method that involves applying a special coating, which is called the encapsulant, over the surface with lead-based paint to create a physical barrier. So that way it can't chip off and become dust to be inhaled. Lead abatement is a process of permanently eliminating the lead-based paint hazards in the home built before 1978. And this process involves methods like removal, enclosure, encapsulation, and replacement. It must be performed by a certified professional following strict safety regulations and clearance testing.
So in some cases, it's sealed. Mm-hmm. In other cases, it's totally removed.
Yes. And it's important to know that as a landlord, if somebody in your property gets lead poisoning, you are liable. It doesn't matter whether you told them or not. You are responsible for removing that. Of course, if there is a child in that unit and we're only getting notified because they had a high level test, at that point, the state health department and the local board of health would get involved to make sure the owner properly removes it.
Let's look at additional preventative measures that families can implement.
Yeah, so just for the viewers watching, things that you can implement today in home to help limit the risk to your family. So frequently washing hands and toys. It's hard with children because, of course, everything goes into the mouth, but definitely before they're eating as well. You want to wipe down and clean dusty surfaces regularly. You want to remove your shoes prior to entering the house to prevent tracking lead into the house, because we all know the soles of our shoes are very dirty from walking in the outside environment.
Right, that's a good point, because you could be visiting an historical site.
Yeah.
Right, and then likely lead having been used on that site, and then not knowing potentially you're tracking that into your own home.
Yes, and it can be very concerning what is on the bottom of your shoe. So just
Right.
as a staple, don't wear your shoes into your home.
We should do a program about what's at the bottom of your shoes.
Yes, I'm a little afraid to do the full research, but that would be very interesting. So when we're thinking of our older homes, we also think of the piping that the old plumbing that may be in there. So one measure with that is running cold water prior to turning it hot when you're in the shower. But again, that becomes a whole level of risk. So if you're in a really old home and you don't know about the plumbing, or if it's ever been addressed since the original home, again, call your local board of health, see where you should get started and determine your level of risk. You also want to think there is lead traces in soil. So if you have children, you want to, they say, prevent children from playing in the soil. Obviously, you want kids outdoors. You want them getting dirty.
Mud pies.
When you think of it, yeah, just that goes back to your hand washing. Your children might be playing in the dirt, but make sure the dirt's not entering their mouths and you're washing their hands before they're eating or touching their faces.
So with that said, lead is a naturally occurring element?
Yes, it is naturally occurring. It's obviously in our general community. But again, they really have determined that our number one, like that lead paint and that lead dust, those are really the number one contributing factor to lead poisoning.
Right. So I would say that even though, I'm thinking that even though there may be lead in the soil, it probably would be at those concentrated numbers that you would find in a lead paint.
Yes, yes. But again, our children are a little bit more likely to absorb it, and they're more likely to put any of this in their mouth, whether it's the soil or the windowsill and the paint.
Well, they eat dirt once, they probably won't eat dirt again.
That's true. That is true. And then lastly, it's just maintaining your home. So
you talked about that alligator pattern.
Yeah, so like if you're walking around your home and you know that it was built before 1978, and as I was doing this research, I had to look up to double check my home even. But there are ways, and on our next slide, we actually have finding out your level of risk.
Right.
So ways that you can do that. So you want to find out the year that your home was built, and if any de-leading has been completed in your home already. So ways that you can do this. So to find out the year that your home was built, that can be found on the city's assessor's website. So I know specifically in Quincy, we have an assessor's website. You can type in your address and it will give you that information of when it was built. And that is pretty universal with databases throughout the nation.
Right.
So when in doubt, if you can't figure it out online, call your local board of health or call your city and just ask somebody to help you. So it's figuring out when your home was built so you can kind of determine what year the paint is from. And then to find out if your home or your rental was de-leaded, residents can call their local health department and the state childhood lead poisoning prevention program. So I do have that information under resources for the Massachusetts program. But again, if you're not in Massachusetts, please look at your local community or local state laws and resources. And it's also important to know that your level of risk, if you are that homeowner, that when you purchase a home, that is in the closing paperwork again, the lead information. They would also have to show if they did abate the problem. And if you are a renter, your landlord should have that information. But when in doubt, if you don't know where to start by calling the health department and just figuring out the best steps to take.
I know the concentration of this program has been young folks. It has been children. But lead, even for adults, has negative effects. It might not have developmental effects because that starts obviously when you're young. But I know there was a story recently about the concern of protein powder and lead found in some protein powder.
Yeah, so as all the recalls, so there can be many products out there that we're noticing as all the testing, we're noticing they can have high traces of certain, like lead, for example. So you want to make sure try your best to look at those recalled products. If there is a product that's marked for having really high lead concentrations, make sure you stop that product. It's really hard because with the way our world is now, there's so many products out there.
And coming from a bunch of different places.
Yeah, so if you have concern yourself, you can start, again, that health department, or you can consult with your doctor, and you could kind of determine, let your doctor know what your concerns are, if you're having symptoms, or, because sometimes you will see people will have headaches or trouble concentrating, but it can go hand in hand with many other health conditions in our world. So when in doubt, check in with your local board of health and check in with your doctor to determine your level of risk.
And lastly, I know this is Quincy specifically, Massachusetts specifically, but let's give out those numbers, and the website will be down, along with the numbers will be at the bottom of the page, but it doesn't hurt to actually go over the numbers. So we'll start with the Quincy Health Department first.
So our main line in the health department, we are at 617-376-1275. And we have 4 housing inspectors and sanitarians that would be happy to answer any questions in regards to this. We also, for Massachusetts specifically, that childhood lead poisoning prevention program, their main number is 800-532-9571. And the information can also be found on mass.gov in regards to the childhood lead as well. And then the Quincy Office of Healthy Homes, their phone number, 617-376-1428. They have a lead abatement program. And if there are, of course, when you apply, there's different eligibility criteria that you have to reach. But if an individual were to meet that criteria, they would help with a loan, which helps pay for everything associated with lead abatement, because it includes inspections, testing, the actual abatement itself. And again, that can be worth up to $30,000, and it's a 5-year forgivable loan.
And I know during that process, you have to relocate. The family has to relocate.
Yes.
And the cost would be covered.
Yes, because that's like a big concern with it. Like $30,000 is not light, and a lot of people don't have that to fix a problem like this that they didn't expect. So I just think that's why I say start with the health department, because even as an owner, there are resources out there. And I know I got a little bit specific to the Quincy community in this episode, but if you are outside of Quincy or you're outside of Massachusetts, check in with your state health department or your local board of health, because their protocols will probably be very similar.
Very good. On that note, I think you did this topic justice. Thank you so much.
Great. Thank you so much for having me.
You're welcome. And thank you at home for watching. And just please remember to support your local access station in the community in which you reside. Take care.